So this will be my second part of the lecture. The first one is just condensed version. So I'm going to have some different conference I give, different part I skip, I will add on. I think this is a slide from one of the IAOMT I was giving a lectures. And first the quiz. Do you know what that famous denture is made for? Whose denture that is?
George Washington.
Oh man, who said that? Oh yeah, good for you. Yeah, it's from George Washington's denture there. So I wrote here my book, Accidental Cure, and I realized that if you divide it up, it's called accidental. I thought it was kind of interesting. So I was kind of making fun of this to the dentist, biological dentist, this accidental cure dentistry. And if you understand the dental part of it, sometimes you can cure all those what we call impossible cases. Only problem is you cannot do it by yourself. You have to rely on dentists who understand. Others can make things bad to worse. So that's a part of the message I had. So let's look at from here. This is from Dr. Fritz Kramer, who developed this tooth organ meridian chart. It is in my website as a color. You can print them down. You can print them. The relationship with the tooth and the rest of the organ system. This is what we call $1 million chart, not for medical doctors, but for dentists. So I sent to dentists about this case after case, and all the root canals and cavitations. And for dentists, you have to understand. You need to work with a medical doctor who understands their relationship. And anyway, so please look into that. Dr. Cook will be spending more time on that part of the dental and medical relationship. This is from Unsuspected Dental Medical Complex Problems. We all know about the amalgams and the root canals, but what about this galvanic current, the battery effects? I used to measure it all the time, and after I say, why should I measure this? The dentist should be able to do basic concept. Anytime you have a metal and metal, especially different alloy, give you very high conductance. Normal, the battery effects is, if you do without any fillings, will be about 5 millivolts to 10 millivolts, and about less than 1 microamperage. But if you have a metal, like especially gold and silver, I have one patient about 400 millivolts and like a 20 microamperage. And this patient, that particular patient developed MS 1 year after they had a big, large crown. And one of the first things I told them is, get the crown out. And I don't know what happened to him, but all kinds of weird neurologic symptoms associated with this galvanic current. Cavitation, this is the infection of jawbone after the extraction. It's very common around wisdom tooth area at 17 and 32. I see it all the time, but when you look at the x-ray, it doesn't show. A lot of them, even 3D CT scan, cone beam doesn't show unless you do check for meridian testing. This is what you pick up, especially retromolar space X at 17 and number 32. TMJ, implants, heavy metals. Now, most people know Hal Huggins. He's the one champion about the danger of these silver fillings, amalgams. And then he talks about later on the danger of the root canals. Before he passed away, he will start talking about some of the danger of the implants. Now, many biological dentists are against amalgams and root canals, but they still do implants. I don't know what you do. I have no idea. But anyway, in Australia, I'm afraid to know, actually.
I don't put them in.
Okay. No, it's a major concern. But from mechanically, it might be sound, but energetically, they create a major disturbance. And Hal Huggins was a champion of biochemistry and immunology, and only later in his understand the importance of energetic relationship that Dr. Cook will explain. He's been talking about energetic medicine and dentistry for the last 30 years, 40 years, or maybe 50 years. Heavy metals is part of the stuff I always look for as a part of the medical problem. Bonding materials, metal allergies, composite materials, high-speed drill, biological dentistry, are they your friends or possibly even create more problems? One of the things is for you medical doctors, I want you to understand about how to measure subtle energy so you know whether the biological dentist get the job done right or not. If you don't know, you have no idea whether it's done right or not. And many times you send them to dentists and nothing changed because it's not done complete, what I call incomplete. So you have to send them back again, but you have to be able to measure it. That's what you're here for. So we can control about dental care as a medical doctor. You don't just give the dental problem to dentists assuming it is done. Many times it's not done correctly. All right? Composite materials, high-speed drill. Dr. Kugel spent a lot of time on danger of the high-speed drill. You have to use a low-speed drill. Proprioception, the bite-related problems. Parasite and bruxism, the grinding their teeth. And the pleomorphism of bacteria and protozoa is very common for many bacteria and the parasites, especially protozoa within your mouth. And you cannot just treat them with antibiotics. A lot of them you have to surgically remove them. So those are sort of what I call pitfall, why your patients are getting well. You send to the dentist, just get the amalgam done, but they still have a root canal, they have a cavitation, they have a wrong materials, wrong bonding materials. That's the reason why people may not be getting well. So like they waste their money. And trying to undo it, they refuse to do it again. I'm not going to do it again. I don't know how many people are lost because I insist on dental work to be done. But I'd rather lose my patients, but dental work have to be done. It's just I don't push anymore. I just take care of the parasite, nutrition, make them stronger, and then trying to convince my patient why dental work should be done eventually. And one of the things you'll see is also when you send to the dentist, many patients come back and say, it will cost me $15,000, or it will cost me $20,000 to do it, and I'm not going to do it. And you have to know enough about dentistry where, but I want you to do this part. Maybe 2 root canals should come out, 1 cavitation have to be done. It may cost them $3,000 and $5,000 to be done. The rest of them is important maybe later, because some of my patients are just so sick. It's too much stress to go through $20,000 dental work, but just the minimum, get the couple root canal on, get 1 cavitation. So you have to direct them, the dentist, what needs to be done. The rest of them, dental work, it might be cosmetic type, maybe bridge work to be done, do it later. It's not the most important part. This is from Dr. Patrick Stottebacker. He's a neurologist from Sweden. He wrote a book called Dental Caries as a Cause of Nervous Disorders. I got this book for 1 cent from Amazon.com with $3.95 for shipping. Give you incredible information. And this is one of his diagrams. It's a spread of herpes simplex virus along trigeminal nerve. They just infect the herpes simplex in the eye, and they measure how fast it's traveling to brainstem. They travel about like 1 centimeter or 10 millimeters per day. So about in 10 days, it will reach the brainstem. And if you look at this trigeminal nerve, all this dental work done here, any infection or wrong material will travel along the certain speed. Typically, in about 5 days to 10 days, will go through the trigeminal ganglion and going into the brainstem. It will control part of the vagus nerve. It affects our central nervous system, and also the vagus nerve will control all the GI tract, and all the GI problem will go to the through the vagus nerve, and it indirectly affects our trigeminal and dental problem. It's a simple but beautiful description. Just give you the information why dental is so important. So I highly recommend you read this book, Dental Caries as a Cause of Nervous Disorders by Dr. Patrick Stottebacker. You can get it for 1 cent if the book is still available.
Not now. It's not right now.
No? Oh, well. This is from American Academy of Environmental Medicine. I gave a talk in October 2014. And to emphasize to environmental medical doctors, parasite is a new emerging global environmental threat. This environmental group talks about mycotoxin, EMF, and all those allergy chemical problems. But I say, in your consciousness, you have to add on the parasite as a part of the problem, as an environmental disaster. And so in this slide, I was talking about parasite infection and their infectious relationship, the concurrent co-infections. By the time you have a parasite, they often carry with them virus, nanobacteria, intracellular parasite, ectoparasite, cell wall deficient bacteria, mycoplasma, nanobacteria, spirochetes and limes, prions, fungal-related molds, yeast and candida, genetically modified biological warfare microbes, and also social, political, economical, emotional, and spiritual parasitic relationship. Some people, no matter what I do, they don't respond, or they're very susceptible to parasite problem. And I don't know why, but I think some of them are like in the emotional level in relationship world, that in the parasitic relationship, whatever, they're more susceptible to this kind of a problem. So I always like to think of myself, I'm not an expert in parasite, but I stumbled into this. I don't have 100% success. I give myself maybe 80% success. I'll give myself a grade B, but at least I want you to be aware of this parasite as a part of your problem and treat this. But there are people who have to think about in terms of the relationship, the parasitic relationship in, and they get sucked their energy out. So by the time people say, oh, you got the virus, for me, I'm automatically thinking, maybe they have a parasite problem that was not recognized. So we can measure with our technology viral particle as a DNA. We can measure bacteria. We can measure fungus and mycotoxin. But we don't have a good way to check for parasite. Think of parasite as a very advanced life form, much more advanced than maybe ourselves. They're adapted and the cloak, they are hidden. They're asymmetric threat. So we have to another way of looking at their problems from totally different dimension. So here's the parasite medications. This is what you're going to have. So I'm already bringing up these questions. Which parasite medication to choose from? I did that from try and errors. Start with the Bolivia with the mebendazole and parental palmoil. By going through this, I hope you can save my 10 years of try and errors. How much to give and how long to use? I stay with the PDR. And whatever I was in the army, this is I started. And I realized that people keep coming back over and over again, so I have to keep upping the dose and longer period and different combination, experiment with it. What combination of parasite medication to use? I found it ivermectin, parental palmoil, and praziquantel cover a lot of a broad spectrum of the parasite. It took me many years to come to the combination. I'll get into the part a little bit later on. Which medication balance which specific meridians? So when I see gallbladder meridian, often ivermectin, parental palmoil balance are usually well. If I see pancreas, I have to add on praziquantel. It's a flux. Or liver, I see that, praziquantel. If I see small intestine with a GI problem and diarrhea, usually tinidazole, mebendazole, tinidazole or Alinea works very well. So you have to use the different combinations. So based on which meridian will respond specifically. And a combination of the herbal and homeopathic remedies. Now, I do not use herbs and homeopathic remedies alone as independent for the people who's been sick, but I still use them as a supportive therapy. In between, I'll put them on cycle, but I'll put on natural remedies throughout the entire course. When is the best time to start the medication? When I see patient, I prepare my patient. I don't start right away. I put them on some kind of bowel cleansing, give them kidney support, liver support, lymphatic support. If they have a problem with the gallbladder, I may put them on gallbladder support, spleen support. I'll put them on the support at least 3 to 5 up to 7 days before I start killing parasite. So don't start right away. And once you start, I'll go through the cycle. During the cycle, I will follow the moon cycle, so around full moon. But in the beginning, I just put them on. About 5 to 7 days later, start killing those parasite medication. Preparation before starting the parasite medication, drainage. And the drainage support. I always put them on before to minimize the side effects. So I do follow moon cycle as a means, as a part of the maintenance. I typically use 3 months to 6 months as a part of the cycle. Some people may require even longer than 6 months. What kind of side effects or side benefit you expect to see? This is what I hear about this, by the way. Now, people can complain, dizzy, lightheaded, sparkling light, dim light. I said, don't panic, because vision may improve. Don't try to check your eye exam because you may need another glasses because you get a better vision, not because you get poor vision. But while you're killing the parasite, they may release fungus, and they may release mycotoxin, they may release bacteria, they may release virus. And I have a few cases, I've done thousands of people, at least 2 I can distinctly remember, developed pneumonia. I have a 6-year-old kid with a seizure disorders, put on parasite medications, and he developed pneumonia. I think what happened was the parasite, part of the life cycle, they love to go to the lung as a part of the life cycle, and we killed them while they're in the lung, and they died, and then they're creating the bronchial symptoms and develop pneumonia. Very rare, but it can happen. So I usually tell my patient, don't panic. Those things can happen. Sometimes we have to give them antibiotics for secondary infection. They may release bacterial or viral infections. What did I say here? Prescribing medication without a confirmed diagnosis. Now, that's a big one, really. Can you treat without a confirmed diagnosis? Now, I went through medical board on that one because I was using the meridian testing, and I was in military for 25 years. I used this in Bolivia, treat 10,000 people. I was a faculty member at WashU Medical School as a clinical instructor at that time. And basically, they left me alone because I didn't claim. And in your handout, there is a 5-page disclaimer. It says, when you say to your patients, you don't say you have a parasite. You say, based on your meridian testing, based on your bioresonance phenomenon, I'd like to treat you as if you have parasite problem, but not based on standard SIR test or DNA test. You have to make that clear. It is in your handout, 5-page disclaimer. They have to sign it before they get a prescription. You have to cover as much as you can. So it's not a definite test, but based on my experience, this is worthwhile for you to try. If they're comfortable doing it, you do it. Because in the beginning, when I was doing this, they were going to get a second opinion by infectious disease specialists or any other internists, and they say, oh, you don't have they do SIR test, you don't have a parasite problem, he's a quack, don't listen to him, whatever. That kind of stuff, I hear that. But so I make sure they understand that and you try, but if you do standard test, it's not going to show most of the time. So you have to legally cover yourself. This based on, I went to medical board, I went through this. So if you want additional protection, join the army. And volunteer to go to Bolivia or, Iraq or whatever, It may give some extra protection, but anyway. And patients who are suspicious and doubt, don't treat them. They say, it may not be for you. When you're ready, we'll treat you. But, if you're going to go to second opinion, it's going to be a waste of your, situation. It's better just give them natural parasite remedies and homeopathic remedies. Let's start with these natural remedies first and see how your body responds. And some of them may feel better, but they may have a dramatic impact for most people. And sometimes this EAB meridian testing reading is all normal, but still suspicious of parasite. Now this is what we call advanced technique. This is trying to unmasking it. So after I've been doing this for, 15, 20 years about just parasite doing. Sometimes I get stuck. You know, the professional Bob I was telling you, it looks perfectly fine. You bring it to all normal, and there still are some symptoms, and I didn't know what to do with this paper. So I was experimenting with the different techniques. First, I was using light therapy. I was flashing the light in the eye with a different light, blue, green, yellow, and I realized that it got directly into the cornea, actually. And sometimes you get different reading. And now I have I'll demonstrate to you later on. I use actually light we can amplify to 1 million amplification. And we can see sometimes creating a contrast. Sometimes I will use a crystal. I'll use a frequency like a zapper to make the parasite to move. Or I use an acupuncture needle in. I do some vibrational therapy to shake the body and all those different techniques to see the hidden problems. But that's more like advanced technique. If for demonstration have some puzzling case, I'll get into that part. All right? So this is an important part of it. Do you have any question on this? Because you're going to go through the exercise. So you have to feel comfortable using this parasite medication. So you may not have heard of this, but there is a such thing called paleoparasitology. At least it was very popular about 150 years ago. But what they did was they always dissected mummies. Was some frozen mummies of some kind in a tundra somewhere, and they dissect, and they realized they all have a parasite problem. And including this Iceman, guess what? He's got Lyme. So most of you probably know about that. They've done in ancient Romans, and all these ancient Romans have a lot of parasite problem from fish tapeworms, because one of the food is called fish sauce they make is called garum. It's a ground up fish they use dipping with the bread. And then when they look at some of the human body remnant, they check, they all have a fish tapeworms. So they're the one who also developed multiple toilet, running water, washing hand, all this to prevent from developing parasite problem. And they couldn't get away from this darn parasite. This is just from looking at this, how infection may play a role, chemicals, nutritional deficiency, genetic mutation, and other factors like dental, EMF, and toxic emotion all create affecting metabolic dysfunction, mitochondrial damage, and cancer development. So we've got virus, bacteria, fungi, and parasite. We can measure viral, bacterial, fungi reasonably well, but we just cannot measure this parasite. There's not a reliable way to check. So by the time you're treating for a virus, I'm thinking in my mind automatically, think about that, maybe there's an unrecognized parasite problem. That was from Environmental Medicine Conference. And we'll get into a little bit about acupuncture meridian assessment. This EAB developed by Dr. Vol. And for me, what I do is a simplified version. I call it acupuncture meridian assessment. There's a couple of reasons why I do that. Now, some of the EAB practitioners, I've been going to so many different places to learn, and I just cannot process the information because they're into homeopathy and they go through 30X, 6X, 1M, LM. You know, when you get into all those things, it's not part of my background. I kind of understand, but it's not my information. So I've been experimenting with my own. And I stumbled into parasite medication, and I could balance so much faster than what I've been learning from these classical EAB practitioners. So I was doing this, and many EAB practitioners who watch me what I do, they like to pointing out, you're not doing EAB, you're not doing EAB, you're not doing EAB. So I said, I got tired of it. I say, all right, I'll call it AMA, acupuncture meridian assessment. That's the correct description, because that's what I'm doing. And there's another benefit of saying that is, when you say EAB, it becomes automatic red flag by insurance or FDA or medical board. So you don't want to use a language like EAB, but say, I'm doing acupuncture meridian assessment. I've been thinking of maybe changing the name to medical acupuncture meridian assessment. That will become MAMA. I have not made up my mind. In case AA may come down on me. Call it, I'm doing mama. You know. But anyway. So do not use a language like EAB. I'm not teaching you classical EAB. But you want to know more about like a classical EAB, you have to talk to that man like Robert Cass. And Dr. Cook will teach from based on dental aspects of it. All right? Any question on this? Okay. So history of acupuncture in China, in USA, we think it's coming from China, some ancient, think of it as an ancient civilization rather than China itself. Some people think it's coming from Tibet. Some people think it's from India, Sri Lanka, whatever. And there was a James Rasson basically introduced whole acupuncture during the Nixon's presidential visit to China. FDA approved the acupuncture used by licensed practice in 1996. And even military using it right now. And Stanford Medical School offered 300 hours of medical doctors for medical acupuncture training. I complete this 300-hour training myself to have a better understanding of what I was doing. Because I went through the medical board. I said, I need to have a better credential myself. So I took this 300 course. So I have a better understanding. So I encourage you, if you are interested more about it, learn more, pursue, let's get more training. So we have a traditional Chinese acupuncture, Japanese, Korean acupuncture, scalp acupuncture, ear acupuncture, laser, and we got acupressure, we got battlefield combat acupuncture. Isn't military? Dr. Nitschau teaching this on ear acupuncture as a means for soldiers to be able to complete their mission. When the pilot with the pain, they don't want to give them pain medication. They want to give them just a ear acupuncture that can fly this expensive equipment without judging their impairment for the judgment. And then there is a EAB, what I call acupuncture meridian assessment. This EAB has been around since the 1940s and 1950s. So why acupuncture? Why alternative medicine? You cannot say, I put some needle on him and getting photon therapy. Because too many people are dying from the side effect. That's why. I'm not going to go into those numbers, but even non-error adverse effects of medication, over 100,000 people are dying from the side effects. Same thing. So what is the basic science on acupuncture? They talk about this thermoelectric phenomenon with the bimetallic effects, electron transfer when they put the needle in. And that's why we are measuring the conductance and resistance. And there's from physics, mathematics, and biology behind this acupuncture. And I have my own theory about this concept, but anyway, they talk about electrical propagation along acupuncture channel, bioelectrical property of acupuncture point, morphological studies of acupuncture point, biological communication network, electrical semiconductors, nociceptive transmission, vasoactive intestinal peptide, perineuronal transmission network, all play the role for acupuncture. The way I explain to my patient is think of this meridian system as fiber optic system. That's the best I can explain. This fiber optic system is based on the water molecule as a semiconductor. Now, Professor Pollack in University of Washington talks about fourth phase of water. There's a superconductor as a water. Along the fascia may conduct that transmission of the information at like a photon transmitting, as almost like a fiber optic. But when you look at it, it does not define channel itself. So that's how I look at things. Functional MRI of brain with acupuncture, what they did was there's a difference between sham acupuncture with a real acupuncture difference in brain activities. They use acupuncture for organic lesions, mainly in the United States for pain problems, for surgical analgesia, neurological, substance abuse, and psychiatric use. So how did they get into acupuncture? He says, that's odd. My neck suddenly feels better. You know, who knows? We'll get into this. You know, but. So I told you about this Air Force colonel. Do you have any question on him? By the way, I told you about the case. This is what I call nightmare case as an internist. How are you going to do with this until? So what happened was he got better, and I was invited to his physician. His physician is a White House physician taking care of Vice President and down. And he's a colonel in the White House. And he was at the Air Force, at the Andrews Air Base. They're called Malcolm Grove. It's a hospital there. And within the hospital, they have a small annex called Pentagon Flight Medicine. And guess what they have? They have a acupuncture clinic. And I've been told that congressmen go there to get acupuncture. So our tax money is used for congressmen to get acupuncture, just in case you didn't know. There's an acupuncture clinic run by Air Force Colonel Nitzau here. And this is part of the thermal imaging I use. One is me, actually. I was in Smithsonian Museum, and they have a thermal imaging looking at you, and I was looking at it, I realized that I recognized his face right away, and the temperature was different. I realized that I got dental problem. So I went to the dentist based on the thermal imaging from Smithsonian, monitoring the face. And this is how I studied with from Bolivia. So this is what we're going to practice all day, today, tomorrow, and Sunday. You get the baseline. You're going to use a different combination of parasite medications and see what kind of response you get. It's just statistical probabilities. So you have to practice this, but it will save you a lot of time because I already give you what kind of medication to use, right? We're going to just practice today, and then tomorrow I'm going to hand out the actual medication for you to try. I'll give you about 6 different medications for you to take it and play with it. And I encourage you to take some, maybe, I got some extras. You can take it for yourself. You never took parasite medication. What is it like? And you may pass next day some aliens out of your body. So acupuncture, that's where we are measuring the meridian system. A lot of this scientific base of energy medicine was written by Ashman. Here's from Pop talking about in Baden-Baden how these cell dividing through photons, how they cell communicate. That's what I was trying to explain. Now, all living organisms possess complex electromagnetic field. These fields disappear completely with death. Biological systems are surrounded by such biological fields and also gives up biophotons. Classical medical fields focus for only visible solid body and do not accept the invisible field. So we're going to explore that invisible field, the subtle energy field. The matrix and matrix regulation by Dr. Pissinger talking about this ground substance. We have all those cells, and we do a lot of blood tests to realize what's going on in the cell, but there's no direct connection. There's many interference, and this ground substance is called matrix based on proteoglycan and glycoprotein, and they function as a semiconductor. So we know when you put the needle in your toe, have an instant effect in your head. They transmit almost like a fiber optic semiconductor. These are some of the what we call alternative medicine we have. We're going to skip this part. The electromagnetic spectrum, we live in frequency and wavelengths. We've got radio wave, we've got gamma rays, and somewhere in between, we've got microwaves, soft X-rays, ultraviolet, infrared, and visible light. And the EMF has become more and more problem. I told you about the color therapy. So just mercury alone, any complicated case, I look at mercury as a part of the problem. So I do heavy metal tests. It can cause I'm not going to read this because you already know, right? I don't want to bore you with this. But if you look at the actually biochemistry, this is from Boyd Haley, 20-some years ago in environmental medicine conference in La Jolla. I'm not sure you were there, but he was giving a lecture. When I saw his slide, I was getting so excited. He's talking about all those nucleotide binding protein inhibited by mercury, and sodium potassium kinase is the most sensitive to mercury more than any other enzymes. Why am I so excited about this sodium potassium ATPase? Because that's one that produces, mitochondria produces all those ATP to maintaining sodium potassium pump. And they are the most sensitive to this mercury. So we talk about energy medicine, but we cannot ignore biochemistry. Biochemistry is the basis of the actual biophysics and energy medicine. And it says sodium potassium pump. Sodium potassium pump moves 3 sodium ions to the exterior for every 2 potassium ions to the interior of the cells. Therefore, the sodium potassium pump is said to be electrogenic because it creates electrical potential across the cell membrane as it pumps. Some cells, such as those lining the renal tubules as well as glandular cells, expend as much as 90% of their energy for primary active transport for this purpose alone. So all those mitochondria producing ATP is maintain sodium potassium electrical gradients to maintain our meridian system. So when you're toxic, when you measure this meridian testing, the reading tends to be low. Because I'm dealing with a lot of chronically ill patients. Children are chaotic patterns. Some of them are high, some of them are low. I show you some of the pictures. And so the mercury block this sodium potassium pump. So even if the mitochondria is running, they can generate these gradients to create an energy field. Parasite suck the energy away from you. There's a different phenomenon, but have a similar symptoms. So when you look at all the symptoms, they look very similar, but for different reasons. So if you have a parasite and heavy metal, and you're doomed. So disturbance to self-healing, the regulation system of the body, because our body will always try to heal. And we always screw with our diet and nutrition. And vaccination itself is a major controversial problem. And I see many children with the autoimmune problem associated with vaccination. Insecticide, preservative, medication, chemical stress, surgical scars, and parasite, focal infection, and dental problem. Those are 2 main emphases. We see more and more new infections and toxins, psychological stress, heavy metal pollution, acidosis, electromagnetic field as an EMF problem, allergy problem, and epigenetics and constitution. All those are part of our problem. So although I'm focusing on 2 main problems, I'm not ignoring those rest of the problems. So we have to always address them. But addressing dental and parasite, whatever you are trying to do, your therapy will become more effective. So it will become very complementary. Talk about energy medicine. These are all part of what has been known. Ancient people know this. This is for triple warmer. This is a kidney meridians. We'll practice this, and I do recommend you buy one of these DAR and draw the line. And when you see, let's say, a large intestinal meridian, we'll tell you, so you can tell your patient to educate yourself. The large intestine running through here, it can cause a wrist problem, elbow problem, shoulder problem. It can cause a kind of neck, something like the tightness of their neck, cross your jaw, through the nasal problem, just caused by large intestinal meridian. So buy one of these DAR for your own education, but also to educate your patients. Okay. So the gallbladder meridian, you just draw the line. You will follow the line here. Just go here, knee, hip, going through your pelvic areas and back pain, indigestion, go through the whole process. Do you have any of these DAR? Yeah, buy one of these, Talk about Dr. Verne. Some of them are like a redundant, but anyway, let's go through this. So is there any difference between EAB and the acupuncture meridian assessment? Now, typically I do 40 to 50 points. Now in the German EAB, they really emphasize indicator drop as the most statistically significant. So they really focusing on that. Personally, I don't. I always check the 40, 50 point. I'm looking for the pattern as the first thing I do, rather than focus on indicator drop. But I do use indicator drop later on. Let's say I'm using gallbladder meridian, and I check for ivermectin. And then sometimes we'll go from, let's say it's 25, and then go to 50, like it means your body like it. But sometimes it doesn't maintain, it will drop. Go back to about 35. And then I say, it might be good, but it's not good enough. So I will add another one, maybe parenteral palmate. And they will maintain at 50 and stay at 50. So I know I need the two medications, not just one medication is not strong enough. So I'll use indicator drop for medicinal use. But classical EAV use indicator drop as your main pathologic meridian system. So there's a little bit difference there. A lot of this classical EAV is based on homeopathic concept of energetic medicine. I'm an internist. I'm proud of my profession, and that's what my knowledge is based on. I use medication if I need to. I get to the point. So it's a little bit different medical background. We all use the medicinal testing, and they talk about allergies. I'm more looking at the allergy point as within third finger, as a more like an allergy immunology. So thinking as not just allergy alone, because you say allergy points, you think about allergy problem. No, think of it as allergy immunology point where we see autoimmune problem. When I see there's at least 1 or 2 points out of line, I check multiple points within the allergy point. And if a 6 out of 6 allergy point is abnormal, sometimes I'll check for looking for the cancer problem. If it's like a 4 or 5 out of 6 meridian is out of balance in the allergy point, I'll be looking for autoimmune problem, autoimmune profile. So they give some different ideas. So I consider when you rely on the energetic homeopathic remedies to become a little bit more subjective. At least I'm trying to be a little bit more objective. So I check just 40, 50 points and see how they respond to the certain medication. The beauty with the medication, especially parasite medication, pharmaceutical company already done the homework for us. So we know what kind of medication works on what kind of a parasite. Rather than focusing on naming the name of the parasite, which I tried to do in the beginning when I was this computerized EAV. So naming is not that important as you may think, but which parasite medication cover which category, taking care of this one particular kind of a parasite as a field for, let's say, gallbladder meridian or large intestine or small intestine. Now, is that make clear? I want to make sure this is important. Yes? Yeah. So don't worry about naming the name except categorically. Is this dealing with a tapeworm, flukes, nematode, or protozoal type of parasite? Because we already know from pharmaceutical information. They emphasize dental. I definitely emphasize dental. Sometimes you can do a Vega test based on those. Vega test basically say yes or no. And eventually, you have to decide yes or no. How much medication to give? How long? You have to make a Vega test, yes and no. But I did the homework for you. So most people require chronically patient, like 21 days, about 30 days as a starting point. Maybe you have to repeat that, and then you put them on some kind of a maintenance parasite medication. And based on a concept of bioresonance phenomenon, that's where they respond, yes and no. Either medication, they don't respond, or they may respond. The concept of the bioresonance phenomenon, yes.
So you make no attempt to try to do the EAV type balancing to know which parasite.
Yeah.
You're more interested in which medication is going to be helpful for whatever's going on.
Right. So I know.
So you don't get the slides with parasites on them and try to figure it out that way.
It takes too much time consuming. Yeah. And I used to do all those, like the library within the computer system to find the pinpoint naming the name. It can be quite impressive to patients. In practical ways, it doesn't make any difference. While using like a Esira or Zyto to give all the name of the parasite, not as important as you may think. But what category of parasite is important to know, and you have to listen to the symptoms. So when I look at the pattern recognition, I'm looking at is that my patient's complaint and diagnosis matches with my meridian testing. And eventually, it's like a professional about everything looks fine, but they still complain. That's when I start provoking contrast to unmasking other hidden problem. So history is still very important, most important part, but the meridian to confirm this is what's going on.
But almost any of the many of the parasites could be causing chronic gut issues, for instance, correct?
Mm-hmm. Yeah.
So then you have to figure out which medicine is going to be the most effective.
Right. That's what you do the combination. Let's say a small intestine may respond to tinidazole. You got also gallbladder use ivermectin and parenteral palmate. You got the pancreas has praziquantel. And then the allergy point respond to diflucan. So sometimes you have to use very, not common, but I use up to 5 different parasite medications at the same time.
At one time?
Yeah. Wow. I did it to one of the physicians. And he said, are you going to kill me? We'll find out, And he's doing fine. He's got all kinds of allergy problem and eczema, and this is doing much better. He was surprised that he was able to tolerate 5 different parasite medications at the same time. Not one at a time. But when you're so doubtful for yourself, what you do is, let's try at least 2 first. That's what you have to have enough confidence for yourself. You feel so doubtful, I can tell you patient already feel that you're down. So let's try this ivermectin and parenteral palmate for your gallbladder meridian. And then we're going to give you a tinidazole to get rid of the whatever for intestinal problem. And we're going to go to the flu with let's say praziquantel and levamisole, and then we'll cover your fungal problem after that. You do increment at a time. I think that's perfectly fine in the beginning. Yeah.
Okay.
Feel comfortable?
I'm more comfortable, yes.
Okay, good.
Oh, but it's so much fun.
Yeah. So they have you all those map out all those different points is in your handout. I'm not going to go into that. You know what? Maybe I should go into it. Here's a lymphatic vessel. This is a part of your tonsil. Is a dental point, lung point, large intestine point, central nervous system, pericardium, allergy point. I think I'm going to be too fast, but.
Yeah, and it's not, the handout did not come out well enough for us to actually read it.
Yeah, I'm going to have to borrow some from Robert Cass's handout. He got some more clear handout. Maybe I can borrow from you next time. There's a called cellular degeneration point, triple warmer that controls your hormone. Here's like an adrenal point, control point, thyroid, pituitary. You're going to go through the full exercise on that. Heart, meridian, small intestine. You're going to go through all the foot will be tomorrow. We're focusing on hands today. And I will draw the line, draw the pixel. You cannot miss it. Okay? And you practice. And you can be guinea pig. I'll demonstrate to you and check on you. Okay? Now, when you do that, the point location, angle, and moisture and pressure, they're all important. Usually check hand to hand. Make sure that it runs about 80 or 90 in the range. The point location, the angle is important. We'll all go through the exercise. The pressure, you have to learn how to feel the right pressure, the certain angle. The more you do it, the more you feel the certain pressure. You have to do slight adjustment. You can have a spring that can automatically adjust for you. Or for me, I don't like spring. I like to measure it. Everybody have a different texture of the skin. Some of them require extra pressure to feel it. Children, you don't have to, just light touch. So you have to adjust individual. Within same hand, some of them have a calluses in it. They require much, you have to put much more pressure on. Some of them have a soft and require less pressure. So you have to go through that. For me, it's just instinct, so I don't even think about it. The location, like the angle, I just do it in a way I don't even think about it. But I will draw the diagram where to press into the angle for individual overview, okay? Yeah, so it'll give you some angle to put it in. This is a basic conductance and resistance concept. So scale is 0 to 100. We are measuring resistance. The actual scale is 0 to 600,000 ohms. But it's too much of a big scale, simplifying the scale to 0 to 100. 50 is considered properly tuned. I don't like to use the ideal because there's no such thing as the ideal. I call properly tuned. I like to use the analogy with the tuning the violin. So I tell my patient, think of your body as a fine musical instrument like violin. We're measuring the 40 meridian as a 40 string. 50 is considered properly tuned. 45 to 55 is considered normal, acceptable range, at least in my practice. Some people consider 45 to 60 as a normal range. Some people consider 40 to 65 as a normal range. You have your own dynamic range. Depends on the equipment and your own reference range. But for me, I use 45 to 55 as a within normal range. So anything above 55, 60 is considered too much inflammation. So usually we'll see in my graph, it will be shown as a red. If it's below 45, below 40, it's becoming degeneration. And most of my patients I see as an internist is a chronic degenerative conditions. I see many times in 20s and 30s as a conditions. Sometimes we'll see this very low, but those are people who are basically about to die, if it's all 40 out of 40. Exception to the rule is sometimes people say, I've been playing this baseball all day. The patient is dehydrated and exhausted. Sometimes we read it's very low. And I know that patient very well. I say, why don't you rest, hydrate well, let me check on you next week and we'll go back to normal. So never use that one reading as what's going to happen to you. Because sometimes it's a dynamic system. And any question with this? Conductance and resistance, the scale. That's how I explain to my patient. 50 means it's a properly tuned. 45 to 55 is considered normal range. We can accept up to 40 to 60 as an acceptable range. So people don't get upset about it yet. So if you look at those meridians, they give certain statistical problems and cause. If you look at the lymphatic system, it can be often caused by bacteria, virus, mono, influenza, staph, strep. But always add, whenever they say virus, always add parasite. Because there's no good way to check for parasite. Here's lung. They talk about all those different virus, bacteria, environmental sensitivity. But always look at parasite as a major problem causing lung. Only reason I know is that when I put on parasite medication, a lot of asthma, bronchiectasis goes away. What they think is the influenza, put on parasite medication, they clear out so very quick and very fast. So when you talk about in all this, people die from pneumonia. But I wonder whether there's a secondary infection, maybe a parasite problem, Large intestine, here says a virus, bacteria, allergy, candida, and this parasite. Because we know large intestine and parasite, but we don't think about in the lung or in the lymphatic system. Nervous system, circulation, that's all part of that different probable cause, and the list goes on. One of the fast way to rebalance them is using parasite medication. But if they give you probable cause, I hope I'm not going too fast, but I just want to move along. It's all in your handout. You should be able to read that. So let's look at here. It says your heart. It can be caused by Coxsackie virus, bacteria, geopathic stress, and herpes. But what they don't say is one of the major ones is the dental infections. And dental infection can cause also small intestinal problems. And so here's a small intestine here. It says virus, bacteria, candida, parasite, but also dental is a major one. So when you combine dental problem with the heart and your small intestine, 80% sure we're dealing with a hidden wisdom tooth area. There's a cavitation.
Say that again.
When you see dental problem with the heart and small intestine, the triad is often dental infection in your jawbone. Usually about 17 and number 32. But you have to locate, many times it's way in the back. It's not 17, it's behind 17 or beyond 32. That's a little bit advanced technique, but this is where dentists have to know. When you get into 17 and 32, I usually refer to oral surgeon to handle it rather than dentists, except Dr. Cook. Yeah.
Well, Dr. Bowles said, look at the 9th space. The 8th space is your wisdom tooth, but he says, take a look at the 9th space, which is just behind all that. Energetically, it can show up.
Yeah. So when you see pancreas in your liver, they give you all those heavy metal, allergy, chemicals, etc. Always think about the parasite problem. But when you get into pancreas and your liver, you have to think about fluke and protozoal infections. And often there's a layer and layer of the infection. You get one kind, then next time there's something else will show up and something else will show up. So you have to keep looking at it. Okay? A joint often caused by actually dental problems, stomach. That's what sometimes I will use like a doxycycline or zithromycin, tinidazole. It may cover for amoxicillin, augmentin to cover for H. pylori. And fibroid connective tissue. Make sure people get hydrated very well. And often, some reason, I don't know why, but I see parasite balance them too. You can have a scar tissue as a part of your problem. A lot of what we think is a skin problem is caused by infection. So many eczema and psoriasis goes away with the parasite and antifungal medication. Sometimes I go through parasite medication and then I'll go through antifungal as a part of the process. Fat, referring to for toxin buildup in your body, is often correlate with the liver. Gallbladder, whenever I see gallbladder as a part of the problem, I also make them to do what called gallbladder liver flush. This is what I see, ivermectin, parenteral palmate, matches very well, or sometimes albendazole, mebendazole with the parenteral palmate. Kidney, you'll be surprised how many people get caused by also parasite. It's amazing. Sometimes I see that. And heavy metal is a big one, because heavy metals shut down this kidney function. Bladder, and then there's a prostate. Prostate often caused by, again, especially protozoa. What we think so, prostate cancer is often caused by protozoal parasite. You know Stephen Fry, the Fry Lab. Here now we always talk about this whenever we get together, talk about parasite. And what he said was interesting. He's trying to publish a paper, I think last year or this year. It was about this prostate cancer patient. When they did a biopsy, what they found was, what they thought was prostate cancer cell are not actually prostate cancer cell at all. When you do special staining, it turned out to be protozoal parasite. I'm not sure it's openly for me to talk about it, but anyway, that's what he told me. So it's going to be coming out as a publication, supposedly last year, whether it's published or not.
And he loves talking about all this stuff.
Yeah, okay. And spleen. As a virus, allergy problem, but also parasite may play the role. So just keep that in mind. I'm sorry that it's not printed very well, but this is from Autism Conference. I was just talking in Chicago, 2013. Just a definition of the parasite. It says parasite is an organism that lives on and the host gets its food from or at the expense of its host. So parasite is by definition. You can get all this information from CDC. So I'm not telling you anything new. But how to detect and how to treat, that's CDC is not going to help you on that one. Okay. In the autism conference, one of the things I was mentioning was parasites are transgenerational problem. Not genetic problem, but transgeneration, maybe pass on from mother to the child. And the environment they're growing in, there's a, so they can pass on. So I get more information about what's going on with the child when the patient, mommy is also a patient. And I don't see too many autistic kids, but I have one kid from Kuala Lumpur from Malaysia. 5-year-old kid, cannot talk, autism. Mom is pediatric neurologist. I said, I help so many autistic children, but I cannot help my child. And I have no idea how she found out about my practice. I actually discouraged her not to come. It's too much responsibility for somebody from another country, but she ended up showing up anyway. And Dad is an orthopedic surgeon. They're all Western medicine educated from United States and England. And when I checked the 5-year-old child, he's got like a large intestine, small intestine, gallbladder, liver problem. And I put him on parasite medication in a massive dose for that 5-year-old kid. And I got the message later on, say, he's talking first time in 5 years. Just put on parasite medication. Now, interesting part is, I check for mom and dad as part of the patient. So mom has like a small intestine and large intestine is a part of the problem. Dad has like a liver and gallbladder problem. This 5-year-old child have all 4 out of 4 pattern for mom and dad. 7-year-old sister doesn't have any symptoms. I checked all 40 out of it was fine, totally asymptomatic. So interesting that the meridian can pass on to next generations. And I treat mom and dad parasite medication, but they're functioning. It's maybe minimum, it doesn't bother them too much, but for the 5-year-old kid, it's manifested autistic child. I also did a heavy metal test on him, and he's got one of the highest mercury level I ever seen, over like a 200, well, I don't know the unit, like a 200 microgram per deciliter about mercury coming out. Massive amounts. And mom is afraid of this chelation. She thinks chelation is dangerous. And
Well, mercury is dangerous.
I know, but anyway. But just from parasite medication, I was just telling this story in an autism conference, and I hear many children respond to parasite medication. So I find this interesting. Somehow they found out I treat parasite, but I told them I don't treat children, but they invite me anyway to give a talk, You can get this parasite from everywhere. This is a the birds catching malaria in Alaska. And they talk about some ivermectin, inactivated, all those are from just piecemeal articles. And he says, these antiparasitic agents, ivermectin, induce chloride-dependent membrane hyperpolarization and cell death in leukemic cells. I mean, this is whole secondary benefit. So don't forget to use some of your cancer patients, just put them on, see what happens. But you cannot use wimpy dose. You have to give them massive dose for a long period of time and put them on a cycle. Oh yeah, I was telling this autistic children, mom, these parasites follow money. They go to one doctor after doctor after doctor, spend all the money on a specialist. Sometimes the underlying problem is sometimes parasite eating their money. I have one lady, I have one Good Friday. This is where one Friday a month, patient can pay only what they can afford to pay. And one time there's a lawyer from, 2 lawyers, husband of their old lawyers from New York City came with 2 autistic children. I was a little bit annoyed because by then, I put 12 hours in that day. At the end of the evening, it was 8 o'clock in the evening. I said, yeah, you're a lawyer. Why don't you set a regular appointment? And what they're saying is, we spend each children $100,000 a year with their medical care and special education. And we don't have money anymore. Yeah. It's just correcting, just chasing the symptoms. And that's why I say parasites follow money. Just kind of like, get to the point, mental and behavioral problem often caused by parasite problems, just emphasizing in the autism community. And again, follow the meridian. Get familiar, buy one of those dolls and teach yourself and educate your patient. You'll be amazed how so much correlation you have when you follow those meridians as a system. So, gut problem associated with parasite, dental-related medical problem, understanding acupuncture meridian assessment, We can cure the incurable by measuring the immeasurable. Don't forget the heavy metal screening, food allergies, detoxification, and nutritional support. This is from New England Journal of Medicine. 59-year-old man with abdominal pain and weight loss. That was done in year, I think, 2012. And when you look at the lab, just a slightly abnormal, doesn't give enough information about what to do with it. And I did end up doing MRI and then endoscopy showing some, what they call excessive inflammation in the jejunum, characterized by erythema, edema, erosions. And what they did was, they did a biopsy on this patient, got strongyloid showing up here. And here's a strongyloid there, there's a strongyloid. So exam for ovine parasite, negative. Anatomical diagnosis based on endoscopy of upper and lower GI, duodenal biopsy showing atrophy of the villus, crib, hyperplasia, intraepithelial lymphocyte and foci of inflammation. Sometimes we call small intestinal lymphoma. Most likely we're dealing with a parasite problem. Positive for strongyloid Stercorellis. They use ivermectin for 2 weeks, hospitalized for 7 days. You know how much it costs for 7 days in the hospital? Probably they spend at least $250,000 with all those diagnostic tests. I use ivermectin every day. Don't be afraid to using it. When you're done with my lecture, you might be eager to use ivermectin. Test on yourself tonight. I give some extra, I got some whole bunch of extra pills for you to try. Okay. It says more than 60% of personal bankruptcies in the USA arise from inability to pay the cost of the essential health care for serious illness. Right now, 50 million Americans are without the health insurance. Here's an albendazole therapy, an enteric parasite in the United States bound refugees. They say they use presumptive albendazole therapy administered overseas before departure for the United States was associated with a decrease in the prevalence of intestinal nematodes among newly arrived African and Southeast Asian refugees. This is from New England Journal of Medicine. One thing I want to point out, all those reduction in Ascaris, hookworm, trichuris, strongyloid, any nematode, multiple nematode GRD, but over here it says rise in entamoeba. I want to point out on this one, the reason is parasites have its own ecosystem. If you get rid of the one kind, there's another chance with some smaller one have a better chance to survive. So you have to catch them later on. You never treat them once and say, that's it. That's why it's very difficult when people come from East Coast or West Coast coming from another country, because you need to monitor them periodically. And so you get one dominant parasite, and you have to wait and see what happens, and you have to get rid of another one. That's why I would like to point out there's an increase in incidence of entamoeba as a part of the looking at the ecosystem. So parasites have a truly pleomorphic, complex life cycle and community of ecosystem with many different life forms. I guess I can say many lives for many parasites or something like that. I have to have a different title for Scientific American talks about your ecosystem. The latest study shows the 10-to-1 ratio might be wrong. The latest study shows the latest scientific study shows the current ratio is about 1.3 to 1 ratio. It's way overestimated. We always quote 10-to-1 ratio for the bacterium. There's a published in Journal of Microbiology, just came out, I think 2015, just came out here. I'm going to skip this part here. One of the questions, yeah.
Is it 1.3 to 1 you say now?
Yeah.
Oh, interesting.
Not 10-to-1. 1.3 to 1 ratio is the latest study. We always quote 10-to-1 as a Bible, but it says not true anymore. So one of the questions is there a role for therapeutic parasite? Joel Weinstock on inflammatory bowel disease using pig whipworms. release a lot of allergy problems. So parasite might have co-evolved in a way that the parasite actually help regulate the human immune system to prevent allergy. That's his thesis. My feeling is when you have this parasite, by definition, they're not really parasite because it created its own problem. So maybe there's a concept called symbiotic parasite, perhaps. But I'd rather get rid of the parasite rather than introduce another parasite. Luckily, this pig whipworm supposedly cannot survive. They can probably compete with fighting with another parasite and reduce inflammation. But so there might be some therapeutic role for using sort of a non-survivable foreign parasite introduced into our body. You know, kind of interesting concept. Are you familiar with the right wine sock? You hear about this? Mm-hmm. Yeah. Oh yeah, here it is. This is actually from the veterinarian magazine. One of the vets sent this magazine to me, and I was reading it, and it says, how could my queen have revolting tapeworms? I'm more worried about her. She looks a little bit too thin, but she's worried about her dog. It says, iverhot. It has you know what this one has? It says ivermectin, parental palm oil, and praziquantel.
Chewable tablets.
You know, it took me over 10 years of a combination to realize that ivermectin, parental palm oil, praziquantel works great for so many different parasite problems, only to find that vet already knew this. I didn't know it. But I couldn't believe this when I see the magazine. I said, wait a minute, it's got ivermectin, parental palm oil, and praziquantel. It took me 10 years to figure this one out, you know? So,
What does it
yeah,
cost?
it's not that expensive.
Can humans take it?
Oh yeah, why not? Yeah, some of my patients simply cannot afford to get prescribed medication for human consumption, and they'll go to the what they call farm, veterinarian, like a, what, yeah, and they use like a veterinarian for the horse. They sell in a big tube. They squat and take the medication, and they say they feel pretty good.
I've actually used the ivermectin for the pigs. The
Yeah.
injectable, and I just use it, I've used it orally.
Yeah, so you can use it. I cannot officially endorse that kind of, as a part of medical care, but some people do it. So, yeah. I wrote many parasite articles, Parasite and Allergies, Paradise Lost in a Parallel Universe, Parasite Down Under. That's when I went to International Parasite Conference in Melbourne. Yeah. And I saw some patient from Australia. I knew some physician in Australia, so I saw his clients. And most of them are untreated for parasite problem, and they come as asthma, chronic fatigue, fibromyalgia, migraine headache. They all have a parasite problem. But Australian living in Sydney and Melbourne, they don't think they have a parasite. Those Aborigines in those northern part, they have a parasite, not us. Anyway, but please be careful using parasite medication. He got in trouble using parasite medications, doing the meridian testing. So we cannot claim. Just want you to understand this. Even if you get excited about using it, careful using. Don't claim too many things. Rather downplay. Maybe there's a parasite, maybe not. Think as if you have. Don't tell them you have a parasite problem. Okay? Parasite and inflammation, parasite and mental illness, parasite and mind control, parasite follow money. Parasite got on UFO and FEO. That's using the unidentified flying object with a field of unknown origin. Just kind of talk about one Air Force brigade general with a FEO for about 20 years, put on parasite medication, and he got better. And I see many people from Iowa, and I always make people from Iowa. I tell them I need to quarantine Iowa because every case I've seen, they all have a parasite problem. So anyway, there are many articles I wrote, but
We have that problem in DC, parasites.
yeah, politicians and the lobbies. Yeah, those are gigantic parasites. Yeah, I know. This is from, I think, Science News, talk about intestinal bacteria alert whipworm eggs that when is the time to hatch. That relationship, bacteria, parasite, all that interact. It's a very dynamic system. And for migraine headache, you have to look for most obvious things like hypoglycemia, dental problem, but think about parasite problem. I don't know, so many migraine headache went away with the parasite problem, especially with show gallbladder, liver, meridian. So that's what you look for. Epilepsy and seizure disorders, always look for dental, but also rule out for parasite. There were several cases of epilepsy went away after parasite medication. And again, how do we know what kind of parasite and what kind of medication to use? By understanding meridian. It's all written for you, mapped out for you. Say same thing about this a parasite. Or about nutrition. Now, I don't put on nutritional program right away. I need supplement. I only put on parasite medication first before I put on any kind of a supplement because I don't want to feed parasite. So I'm kind of picky about that. At least I finish the one round of the parasite, if not two rounds of the parasite medication. And then I'll put on nutritional program. Meanwhile, in the beginning, I'll put on cleansing, detox, drainage, kidney support, liver support, lymphatic support. Those are things I do in the beginning while we're killing parasite. And then I'll put on nutritional program. The herbs, I went over those. Any question on any herbs? Classically, the Halder clock use black walnut, wormwood, and clover, and I still use that as my basis of parasite medication. I have one elderly couple came from Australia near Brisbane, and they had a lifetime asthma. Both of them have a lifetime asthma. And when they came, they stayed here about 5 weeks in a Hilton hotel. And when I checked this parasite problem, and dental is one of the major dominant problem, sent to the dentist and put on parasite medication, including put this black walnut, wormwood, and clover. And they look at this a bottle and they say, wait a minute, this black walnut comes from Australia. Right next to Brisbane, they're living. That's what this. This is from MediHerbs, and anyway, that's kind of interesting. So this Australian coming here to get this parasite medication that comes from Australia, And he's here for 5 weeks. When he left, he became the Missouri resident. He didn't have to pay the tax for the residence, so he would save some money. These are the medications you have to feel comfortable using it. At least also about 6-7 medications. Ivermectin, parental palmoid, praziquantel, mebendazole, albendazole, Alenia. Those are stuff like Tynados. Those are things I use over and over again. These are the combination. Again, ivermectin. It's all in your handout. Parental palmoid, Alenia, especially for cryptosporidium with the intractable diarrhea. We'll see in the small intestine. The best medication to use is Alenia, Tinidazole, praziquantel, Varmax or mebendazole, albendazole, and albendazole again, levamisole. It's a kind of interesting drug, levamisole, whether you heard of it before. It's a general broad spectrum antiparasitic. It's also immune modulator used in other chemo for colon cancer, melanoma, and head and neck cancer. It just says, it's an immune modulator. Makes you feel comfortable using it. Typically, I use 50 milligram 3 to 4 times a day. Recommend dose is like once a day, but I use 3 or 4 times a day. 50 milligrams for 3 weeks to 30 days. It's an effective inducer of interferon and used in combination therapy for influenza. kind of interesting for viral, using parasitic medication. And they also use for the skin problems and leprosy. They say it was withdrawn in 2003, but it's available now. I think there's been some contaminant. People that are using cocaine has been using that for whatever the reason, and temporarily withdrawn, but you can still get it as a compound pharmacy. Here's a metronidazole. You can read this. I'm not going to go through all the line by line. And again, important question is, can you prescribe medication without confirmed diagnosis? That's one of the legal issues. You have to feel comfortable. In your handout, I'm going to go over those later on, what's in your handout. There's a 5-page disclaimer. And you modify what I wrote into how you will fit into your practice. Because in my disclaimer, I'll talk about I was in military 25 years, I was in Bolivia treating 10,000 people, etc. It's not pertinent to you, but anything else, you can use it as a part of education for your patient and make them to sign saying, we are treating for parasite but without the standard test, but as if you have a parasite problem based on the meridian testing and based on your bioresonance phenomenon. Now, this one you have to feel comfortable using it. This is what I use the most. Experiment, maybe 3 days at a time. 2 or 3 of them in combination, see how they respond. And I usually encourage for you to try on yourself first. That's why I got plenty I bought some parasite medication to try on if you want to. A lot of people with a parasite problem have a food allergy problem, so food allergy is part of my routine test. Here's a fellow with about nutrition. It's a Jeff. It is in my book. This is how he looked, and this is how he looked now. Within about 4 months, he pretty much raw food diet. First time I helped him. Second time I could not help him actually. He went to some guru in California for raw food diet. He started getting raw milk, raw chicken, raw beef, raw lamb, everything raw food. Transform his body from this to that in about 3 to 4 months. And anyway, kind of interesting.
You said raw
Yeah,
chicken?
yeah. He brought me some to taste it, but he marinated, so it doesn't taste so bad, I have a hard time eating that, But he marinated with some kind of a spice, yeah. So I always tell my patient, think the half of what you eat keeps you alive, half of what you eat keep the doctors alive. And you have a choice which half to eat, But anyway, this is what I call biblical David, and this is a typical American David, who is about 100 pounds overweight, diabetes, erectile dysfunction, hypertension, whatever you have. This happened in about 150 years. It's a rapid transformation. It's an epigenetic problem. And he will have a dental problem, he'll have a parasite problem. Again, I use color to unmask hidden dental and parasite problem. I use as a light therapy as a part of my unmasking technique. I published a paper on biophotonics using Raman spectroscopy. I use a light in one side to prove that our body can observe and respond to the light. So this is from biophotonics. And I think one of them was like we use a blue light, and there's a Raman shift from before, after blue, indicating where our body can observe light. We publish. This is more like an engineering type of not a medical journal, and I never get any kind of a response. But the proof is that our body receive and respond to the photons and light. Kind of a really boring article. It's my pet project. I spent about $40,000 for that project, and I got one paper out of it. Here's a 13-year-old Jewish girl with a Crohn's. I saw in 2010, diagnosed in age 11. frequent bowel movement, indigestion, chest pain, not gaining weight. She looked like a 9-year-old scrawny girl, and she's 13 years old. Seen pediatric specialist, colonoscopy, biopsy, consistent with the Crohn's, IV steroid, and was hospitalized for twice, multiple medication, no improvement, and still complained about stomach aches, straining, cramping, diarrhea, anemic, failure to thrive and stop growing. And look for the pattern. Number one problem is the large intestine showing up. And there's a spleen as a part of her problem. And adiprone, Alinea, levamisole, tinidazole, and from the different cycle probiotics, and made it look almost normal, and she was like a 90% improved. And what I did was I used a color orange, a 1 million amplification for 3 minutes, and detected a still residual hidden problem in a small intestine. I'm creating a contrast, like a phase contrast, using light. And then a few months later, I was using color yellow, and she got hidden problem in the liver, and put on ivermectin and Alinea. And finally, she's growing, gaining weight, no longer anemic, made a team for cheerleading, and she's now in college right now. So she's doing very well. There's a 49-year-old female with a breast cancer, multiple chemical sensitivity, and she have a 9 cavitation operation, 32 out of 54 meridian out of balance. She got burning pain in her chest and breast, a lot of a dental problem. And she's one of those what called chemically sensitive people. She came in a van, wooden chair. She cannot sit in a regular chair, so she have to be especially sit is out. She have to sit in the wooden chair. She got wooden shoes. Everything have to be natural clothes. Any touch, she react to it. One of the nightmare case. I did homeopathic remedies, and she was so afraid, but she took a chance, took the parasite medication, put on, look at this medication, put on tinidazole, mebendazole, parental pomade, Alinea, ivermectin, in cycle. She can only was afraid to take all, so one and the other one to get through it. And once she stabilized, I sent her for the dental work to be done for cavitation. And she's doing pretty good right now. Again, this is autism, tendency of chaotic pattern, looking for the pattern and figure out what we need to focus on. It's just another case, autism, and responding to parasite medication. So I want you to think differently. Parasite and acupuncture, meridian. Think about new medicine based on new biology, quantum effects and biocybernetic medicine. These are some of the stuff I do, but I always do acupuncture meridian assessment by myself. I don't delegate that to anybody else. This is my information. It's like my physical diagnosis. I cannot delegate to anybody else. The reason I only invite medical doctors and DOs and dentists is I don't want to teach somebody else to do it. You learn how to do it by yourself. Okay? Because if you let medical assistant to do the meridian testing and telling you, Doc, you need to use a praziquantel for your patient, then you are no longer functioning as a physician anymore. You're delegating the responsibility to somebody else. You have to be responsible for making a decision making. So only exception will be husband and wife team. Sometimes I don't mind they come. And I'm trying to make it where somebody can come as a team. But if they want to send their massage therapist, nurse practitioner, whatever, to come here, but not physicians are not coming, I said, no, I don't want them. Because you have to be learned by yourself and be responsible for it, in control of this medical care. We have to lead this whole concept of taking care of this patient based on, energy medicine. And if you delegate to somebody else, we're going to lose our field as a professional. We're going to lose this control. So just keep that in mind. It says, I fear the day that technology will surpass human interaction, the world will have a generation of idiots. This is what this automatic program, this, I don't mean anything undermine Zyto or Exciter. I do have a Exciter, but that's kind of a clue, but you don't make a final decision based on this automatic technology. We have to interact with the patient and listen to the history, and we have to make the final decision, not on this automatic technology. So here's my book. If you haven't read my book, I highly recommend to read my book.
I do too.
Yeah, and I think that's it. It's a long lectures, but this will give you sort of a basic foundation why we need to learn this. And we're going to do a lot of drilling. I'm going to do some, take a break, and then we're going to do some demonstrations. Then we'll practice. The hands this afternoon, we're working on food and dental, and we're going to combine them on Sunday.